back. Thanks so much. We've had such a good time with Dr. Creado. He's a treasure for us and a wonderful resource for you. So in this last session, and we did this purposefully, that medications are not the first thing you should do.
Yeah.
The first thing you should do is really understand why you're having trouble, and then fix that if you can. Fix the structure, fix your thoughts, fix your routines.
Yes.
But supplements can actually be very helpful. And we like to do supplements first and then medications. So walk us through your thought process on supplements and medications for sleep-related issues.
Okay. Now, if we first of all address these behavioral strategies, the sleep hygiene, the bedroom, and we're making sure that there's no serious underlying issues like sleep apnea, restless leg syndrome, then we talk about some helpful supplements. Usually patients come to me on a boatload of medications, and I'm in the process of eliminating medications rather than adding more.
Right.
That's the first step you do, because medications can disrupt your sleep. Talking about supplements, there are a few supplements, I would say 10 to 12 supplements I really like that also have the best evidence in support of their use for people with insomnia. One of them is 5-HTP, and it's in serotonin mood support, brain MD, and supplements. What I like about 5-HTP is that it gets converted to serotonin, and serotonin regulates your mood as well as your sleep. So it can help you sleep better. Also, 5-HTP is necessary for serotonin and melatonin production. And as we know, melatonin is extremely helpful for helping us sleep better. However, melatonin is not really taken in the right amounts and the right duration by the right people, and therefore they may over-medicate with melatonin, and they may have actually bad effects or paradoxical effects.
So what dosages do you like of melatonin?
0.5 to 1 milligram, which is people might think is really low because typically in pharmacies you get 3, 5, 10, 15 milligrams, but that's way too high. When we think about melatonin, the levels rise at night around bedtime, so it helps nudge your brain into sleepiness. It's as effective as switching the lights off. It's not supposed to knock you out, and it's only helpful in helping you fall asleep. And it needs to be taken 90 minutes or 60 minutes before your bedtime. So people may take a higher dose, may lie in bed tossing and turning, wondering why it's not working for them. Well, they've taken it too late. Then they start associating the brain with tossing and turning and wakeful worry at bedtime, which will even perpetuate the insomnia.
So what if they've been doing what most people do and taking higher doses, 3 to 4 milligrams or 5 milligrams? Can they just automatically back off and take less, or do they need to wean down?
They can take less because there's no terrible withdrawals from the higher doses of melatonin. Depends on how much you've been taking as well. It's going to be rough. I always tell my patients, if you want to get this right, you've suffered from insomnia for a long time, months, years, you need to put in some effort. If you think about it, if there's anything you're proud of, anything you've achieved in life, you've put in a lot of hard work.
I tell
into
people
it.
the same thing, right?
Exactly. So
what are you most proud of?
Very true.
So low-dose melatonin,
Low dose melatonin,
5-HTP.
5-HTP.
50 milligrams, 100 milligrams of 5-HTP?
Yes, you know, start low, go slow, see whatever you need, and that's how you go with that. Also, GABA is a really great supplement to help you sleep better. It can calm down the nervous system a little bit, helps you more get into a state of relaxation. Could help calm down some excitatory
So like
neurotransmitters.
500 milligrams of GABA, 750.
500, and then you try 750.
So a lot of people go, but GABA doesn't cross the blood-brain barrier. And I don't know whether or not that's true. We've actually done quantitative EEG studies that show GABA elevates theta activity, slow brainwave activity. So maybe what it's doing is it's calming the vagal nerve, which is then sending a signal to your GI tract to calm everything down. And people don't get the gut-brain connection, but there's actually a study on probiotics being helpful to induce sleep, which I thought that was pretty interesting.
That's really interesting. And you and I had a little conversation a while back, just a little while ago, about tea.
Yes.
So I like to take valerian tea. I also like chamomile tea. So if it's evening, I'm one of those people, I'm highly sensitive to caffeine anytime other than in the morning. So I cannot have caffeine anytime past 11.
Right.
Okay, so that would not be one of your supplements.
Most definitely not. But so if it's in the evening, I will have I can't have green tea, nothing like that. So I will have chamomile tea if I'm out at dinner or something like that. But I like valerian tea at bedtime. So talk to us about tea and why they work and which ones are good, which ones are not good.
Yeah, the top two would be chamomile tea and valerian tea. So you're doing it right, clearly, Tana.
Okay.
Chamomile tea is really helpful because it's rich in a flavonoid called apigenin, which binds to the benzodiazepine receptors in the brain. The same receptors in the brain help you calm down and relax.
So it's not just sort of a
Naturally.
myth. It actually works.
No, it does work.
Okay.
So valerian root
Now,
as well can be very
theanine
helpful.
works as well. So you wonder about decaffeinated green tea
Oh.
because it has theanine, or you can just take theanine by itself. There's actually a study
But
on
doesn't that make you focus
postmenopausal
more?
women. A lot of people
Yes,
put it
yes,
in
yes.
sleep formulas. So
Yes.
what do you think about theanine?
I'm confused.
I love L-theanine. It can be extremely effective because it can help regulate your dopamine, your serotonin, your GABA as well. There are studies that looked at ADHD in kids and L-theanine, help them calm down and relax and sleep better. I'm a fan of L-theanine. It's my top
Just not
10.
the caffeine.
Not
that's
the
in the
caffeine.
green tea.
Not
okay.
the caffeine.
Okay, and valerian
we
is a
are
good
not
one.
a
We talked
fan of
about
caffeine.
valerian.
Valerian is a good one as
Unless you
well.
have a sore throat and it
Question, though.
constricts blood flow to your throat.
Question though, some people say they get weird dreams on valerian. I don't, but is that something that's common?
It could be possible. It depends on the dose
Okay.
and the taking and the duration as well. As I said, if you are sleep deprived, your brain will try and make up for it by more dream sleep. So they're sleeping better with the valerian. They might actually have more dream sleep initially, and
But then it
by
will calm
more
down.
Exactly. That's the way it should work.
Okay, so we have low dose melatonin, 5-HTP, L-theanine, GABA, hypnosis, meditation. So I just want you guys to hear.
Magnesium is like
the
my
first
go-to.
thing is not Ambien.
Right.
Now, if the lifestyle and supplement things are not working, what are the medications you go to in the order that you might use them?
Okay. The first step is eliminate any meds that are disrupting your sleep. So you need to work with your doctor or look into the research and look at what meds may be damaging your sleep. Because there might be certain sleep medicines that might worsen things like sleep apnea or restless leg syndrome. So if you have sleep apnea, one of the worst medications you could give someone is Klonopin or benzodiazepine like Ativan.
But they do it all the time.
They do. And then what happens? Their sleep is worse. They're suffocating. They have more depression. And then they increase the dose. So you're not sleeping well, let's increase the dose. It worsens the sleep apnea. It's a disaster.
Yeah.
So the
Okay,
cleanest
so you don't like
medications-
those. Which ones do you like?
If we're just talking about pure insomnia and supplements, natural strategies, and then looking at a medication option, I'd actually go with low-dose gabapentin. Low-dose gabapentin, because it's such a huge therapeutic window. You can give 100 milligrams or 3,600 milligrams in a 24-hour period. So slowly titrating gabapentin, what I like about it is even if someone has low iron levels in their body, they don't know about it, or there's a mild restless leg, it can deal with that as well. It's one of the best medications for restless leg syndrome. I like Lunesta and Belsomra. They're more selective medications, less side effects.
So they don't have the same side effects that Ambien has.
No, Ambien is also associated with sleepwalking, sleep talking.
Oh, interesting.
There are a few forensic sleep cases there where someone has done something in their sleep.
Ooh.
And it's a crime. It's usually a serious crime. And then,
And is the depression that I experienced, is that a common thing or is that just sort of a weird?
no, it's definitely possible with Ambien too.
Okay.
On the labels, there are so many different side effects for each medication. But the reason they're all there is because one person might be affected. Even if it may affect 1% of the population, what if you're my patient within that 1%? Then it's 100% for you.
Right.
And that's really important.
Right.
And a lot of my patients take Seroquel, and they actually get a good response for that for sleep. What's been your experience?
Sedating antipsychotic medications like Seroquel or olanzapine or Zyprexa can help you sleep better. But the reason they help you sleep better is because it's a very potent side effect of the medication. So, as I said, these are medications that have multiple effects. So if you have restless leg syndrome and you're giving them an antipsychotic like Seroquel, what's it going to do? It's going to block the dopamine receptors, probably make your restless leg syndrome worse. If you have sleep apnea, Seroquel and Zyprexa can cause weight gain and worsen the sleep apnea. So they're definitely lower on my list of things to do. First, I'd go with boosting the iron and the natural supplement reserves, then I'd go by the medications that I mentioned to you. Lunesta,
So
Belsomra.
low iron goes with insomnia.
Yes.
So I
Oh, that's not good.
hadn't
I
heard that.
always have it.
And giving iron can actually help
Yes.
insomnia. Now, does their iron have to be low in order for it to work for insomnia?
So they don't have low iron.
Well, it depends on whether you're talking about the iron levels or the storage form or the ferritin levels.
Right.
What I like to test, and we all test our patients for this, is the ferritin levels, a storage form of iron.
Right.
And it doesn't have to necessarily be within normal limits. I want to see it in the higher range of normal, because then you know someone has good iron reserves. Why is that important? Iron helps your brain produce dopamine.
Wow, I've
Okay.
just learned so much during this. This is so
Right,
interesting.
because your iron level
Always chronically,
terrible.
it's chronically low, and so I upped my ferritin.
Yeah.
So
So what's going to happen when you have low iron levels? You'll have less dopamine, or your dopamine is not going to work as well. So you'll have more anxiety. You'll have
well, I was in a
concentration
funk.
problems.
Yeah, I was like not concentrating as well, and I was feeling kind of funky, just not happy as like I normally am, bubbly.
Yes.
So I increased
So
my
if
ferritin,
you
felt better.
have found this
And you have
helpful,
restless leg issues too.
Dr. Creado has a brand new course. It's 21 lessons. And
So
it can
interesting.
change your life.
Yeah.
Because change your sleep,
Oh.
change your life. It's so
If I
important.
miss a half an hour of sleep, it changes my life. So if you're
Which in turn
chronically
changes my life.
right. So if you are chronically sleep deprived, it's just a terrible thing. So
As the saying goes, we are inundated with information, but thirsting for wisdom.
yes,
And
that's
this
so good.
this is the course for people who have been shooting the dark all along, trying to find solutions, struggling with this by themselves. This will give them tailored, directed information on how to improve their sleep in a meaningful way.
Well, you are a wealth of information and wisdom on this topic. It's been fascinating.
It's been fascinating. I'm so grateful for you guys to come on the show and help people out. So thank you so much for having me.
Thank you for being here.
If you want to learn more about this course, actually, you want to learn more about this
you do.
course, go to amenuniversity.com. Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. Go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of the Brain Warriors Way and the Brain Warriors Way cookbook we give away every month.